Injured brain ischemia may be seen with partial pressure of carbon dioxide, PCO2, levels below what value? A. 35 mm Hg. B. 30 mm Hg. C. 25 mm Hg. D. 20 mm Hg. Answer is D. 20 mm Hg. Cerebral vasculature is exquisitely sensitive to PCO2 levels. The degree of vasoconstriction below a PCO2 of 20 mm Hg may be so severe as to induce ischemia. Modest hyperventilation to a target of 30 to 35 mm Hg is recommended once acute resuscitation is completed. Which of the following parameters are associated with a worsened outcome after traumatic brain injury? A. Both D and E. B. Core body temperature 37.5 degrees C. C. None of the above. D. Partial pressure of oxygen less than 60 mm Hg. E. Systolic blood pressure less than 90 mm Hg. Answer is A. Both D and E. The following are associated with worsened outcomes after traumatic brain injury. Hematocrit, HCT, less than 30%. Temperature 38.5 degrees C, 101.3 degrees Fahrenheit. Systemic blood pressure, SBP, less than 90 mm Hg. PO2 less than 60 mm Hg. A 27-year-old man presents after a motor vehicle collision with a severe closed head trauma. On examination, you calculate a Glasgow Coma Scale score of 5 and a left dilated pupil with a sluggish pupillary reflex compared with the right. What other finding will your examination likely reveal? A. Left carotid bruit. B. Right carotid bruit. C. Right-sided hemiparesis. D. Left foot weakness. E. Loss of controlled pain temperature sensation. Answer is C. Right-sided hemiparesis. Uncal herniation is the most common post-traumatic herniation syndrome. The initial pressure compresses the third cranial nerve 3 causing ipsilateral pupillary sluggishness, ptosis, anisocoria, and impaired extraocular movements. Contralateral hemiparesis can develop early after an initial normal motor examination. In some cases, the contralateral uncus is compressed, resulting in ipsilateral weakness. A 24-year-old man presents with a closed head injury after AMVC. The physical examination is remarkable for a sluggish left pupil, right-sided hemiparesis, and a GCS score of 12. What should be the next step in this patient's management? A. 3% hypertonic saline intravenous. B. Intubation and hyperventilation. C. Mannitol, 1 g/kg intravenous. D. Methylprednisolone intravenous. E. Pentobarbital intravenous. Answer is B. Intubation and hyperventilation. Answer B. The most rapid effect on ICP reduction is achieved via intubation and moderate hyperventilation to a PCO2 of 30 to 35 mm Hg. The effect peaks within minutes and should be considered a short-term intervention with an expected ICP reduction of 25%. Prolonged hyperventilation may be dangerous. Steroids may worsen outcome after TBI. Mannitol is generally efficacious and exerts an effect within minutes and lasts hours. Other neuroprotective effects include volume expansion, viscosity reduction, CBF improvement, and free radical scavenging. Hypertonic saline data are encouraging but inconclusive. Stronger data exist in the pediatric literature. Barbiturates exert a modest ICP lowering effect because of their lowering of the cerebral metabolic rate and oxygen demand.